Welcome to a wonderful night of beauty. I see some familiar faces. Thank you all for coming. Tonight, we're going to talk about the aesthetic department, which is run by my wife, Dr. Mary Schmieder. We do all of our things here that are listed, facial treatments, microdermabrasions, chemical peels, special peels. We have our own display here for our own products. We have Park Avenue products, as you'll see. There's about 25 different products ranging from night creams to hyaluronic acids and sunscreens. And anybody who's interested in that, Janet has been in this business for over 10 years. What we're really going to spend most of the time tonight is talking about these advanced treatments. That's what really most everybody's here, and that's talking about the different various lasers. We have Fraxel Thermage, the Lume One Universal, the Palmer, and I'm going to go through all of them. And then at the end, I'm going to talk a little bit about Botox. I'm not going to steal my wife's thunder because Dr. Mary is going to do a demonstration on one of our ladies with Botox, and I'm going to be doing a demonstration on her for fillers. And then we'll wrap it up and have our raffles, and if there are any other questions, we'll stay here afterwards with you. Our advanced treatments, we're going to start off with our, you're going to hear me say this quite a bit, our IPL, our intense pulse light. We have 2 machines, and I will say that's kind of odd. Most offices can barely afford one, but both Susan and Janet have their own machine in their office. They are not exactly alike, but they are very similar in what they do. We have the Luminous One Universal, which Janet has, and the Palmer Starlux are both intense pulse light lasers. They're high grade flash lamps that will break down different wavelengths of light, are used for different things, such as rejuvenating your skin, hitting these little vascular red spots, taking out those brown hyperpigmented spots, helping find wrinkling. They do hair reduction, and we use them all the time for all my surgery for scar reduction. When you get those red, violaceous, purple scars, it's terrific on taking out that color. Here is an intense pulse light treatment after 3 treatments. This man, you'll notice these fine little veins over this man's nose. Well, after 3 treatments, you can see how nicely that changed out. I invite anybody who has not had the photograph with the Vizia to go ahead and do that, because this shows you, this is the before and this is the after, and this shows you the infrared, and this shows you the photo damage. So what you're seeing is here is before, all the spotty freckles, sunspots that they have, and then after 3 treatments, how it rejuvenates your skin. So that's not trick photography. This is something that everybody can expect. We get this about, I would say with nearly every patient, it takes between 3 and 5 treatments. And this is the best price that we have ever had. We're doing a single treatment for $199, which really in this industry is probably $70 to $100 cheaper than most anybody. This is the laser that does help stretch marks, the Fraxel. We have 2 resurfacing tools here. Fraxel was the first one I bought. It is an erbium technology. It is terrific for improving the quality of the skin, the wrinkles, and scars and sun damage. It does very much what the IPL does in a much more vigorous way. There's minimal discomfort, minimal downtime, very low risk with great results. Unfortunately, it takes 5 to 6 treatments to get what we can get with CO2. So people are a little funny, why do you have 2 resurfacing lasers? I do for many reasons, because an active nurse, a drug rep, cannot really be afforded to be down a week or so. They want to come in, get Fraxel on Friday, go back to work on Monday, and just go for it. And this is a terrific tool for that. And I'll show you what we do with some of them here. Here's a nice picture of that, very similar to the other, little Scottish, Irish, German skin. She wants to get rid of those freckles. Terrific, a little bit helping more around with the wrinkling. Another avenue for this is a good friend of mine, was a doctor's wife. She had that melasma. Fraxel is terrific for breaking up that pigmentation in Asian skin. This is a terrific improvement you'll see in wrinkles. Anybody who can't see the softening around the eyes or the pull out here, don't get Fraxel. But that's a very good result. I wish I could get that out of every person with Fraxel. The Fraxel technology shows the different spot sizes of the holes that we put in and the amount of tiny little holes that we can do. So if we're treating somebody for acne, scarring versus wrinkling, we can go a little bit deeper, make the holes a little bit wider. So if we're breaking up pigment, we're going to use fine little tiny holes that are not so deep, as opposed if we were working over a scar, we'd go much deeper and we'd go wider, okay? And that's that technology. Now Thermage is completely different. That's radio frequency. And Thermage has been out, was really big on Oprah Winfrey about 5 or 6 years ago when I started. And what they were doing is that this tip goes over the front of the handheld piece, and they would touch your skin, actually gridded your skin, and they would touch your skin with this about probably 300 times in the beginning, and people were spending $6,500 for one touch because they were kind of selling it as a facelift. Well, what happened is that depending on who was using it, how much energy they were putting in, it was fraught with very bad predictability. So that's the problem here. The results can be subtle to dramatic. The good thing is it's not prejudiced to any skin type, so the darkest black or the albino can use it. There's little or no down treatment, and although this is single treatment, you can repeat it in 6 months to a year. This is a vein laser. This is for, this gets up and hits the blood, treats these little hemangiomas, the large veins on the nose that we can't get with Janitor Susan's IPL, we'll be able to get with Miss Lean's. And here's a nice example of a little hemangioma. For 25 years, I practiced dermatology, and women would say, "What's this purple red thing in my chest? I hate it. Can't you get rid of it?" And I said, "Absolutely. Now we can. We have the thing for it." This is Liz and Mrs. White's new resurfacing laser. This is the UltraPulse CO2. This is the gold standard. This is a $250,000 machine that does the same thing that Fraxel does, only it does it instead of 5 to 6 treatments, it does it in 1 treatment, okay? And I will tell you, I ask anybody, before you sign up here, if anybody's thinking about resurfacing, call around. There are about 7 or 8 machines in the city that are similar. Everybody is charging minimally $3,500 to $5,000 for a full face. There is no other, I'm the only one with the UltraPulse by Luminesce. It's tremendous for wrinkling. Let me show you some pictures. You can get quality results, very minimal risk. This is what you can expect. This is really, I think they did mostly the active in this. They didn't do a whole lot of deep, did they, Liz? See, yeah, this is all that active. You can see the little pattern where they kind of got it. Liz, when she was followed, they do the deep around the eye and around the mouth. And I'm going to show you a photo of the next one. But this is her at 1 day. So you look like you have an intense sunburn. And this is her at 7 days. Terrific. And then here's another lady. They just show us 1 day and 10-day post. This again, just like the Fraxel, just like the IPL, you can see the improvement you can get with the freckling. Wonderful job with that. But check out these necks. Look at this. Look at the alligator kind of just destroyed from the sun. All this nice rejuvenated skin. This is an Italian woman. She's kind of famous because of this big, she's a physician, and every meeting they show this because she just loves the fact of how it got rid of all that sun damage. And this is our patient. Look at that neck, guys. Just everybody, look at that neck. I mean, it is unreal, just terrific. She hated her neck, and actually this is after 2. They did her twice, didn't they? In the very beginning, she was one of our first patients, and Jan was nervous about doing the neck, so we repeated it. This is after the second one. It's just terrific. She is thrilled, and she comes to do Botox in the Nights of Beauty. She'll show herself off every once in a while. She comes in. This is our last machine we're going to talk about, I think. I often say about this when my wife's not here, that this completed me because this was the last of all the lasers. It's a hair removal. We can do a man's back in 20 minutes with this. It's tremendous. This large head that you see here just sucks the skin in, and this 800 nanometer does a terrific job. You got to remember 2 things, that nothing is permanent. As I was wigged out as a young boy in the barber shop, watching the men get their hairs out of their nose and their ears, hair keeps coming everywhere. So even if we get rid of it on your back, your arm, your axilla, your legs, it generally does keep coming in a worse way. So we don't guarantee it forever, we guarantee it for a year. Sometimes you get a little hypertrichosis on the shoulders. We've not seen that, but they ask us to always tell everyone, and it's contraindicated with anybody who's being treated with gold therapy for arthritis. Other than that, terrific. You see the chin, nice job. Arms, even women with polycystic ovary disease, it's a great way to keep the hair under control. Of course, you don't guarantee it because it keeps coming, but it is terrific for them. If you do your legs, it's $3.99. Liz will throw in your axilla. Most every woman and man she's been able to get in 4 or 5 treatments at the very most, I would say. This is the absolute Ferrari of hair removal, and it's killing everybody else in the city. As soon as our website's over, Liz is probably going to have to stop practicing general derm and doing a lot of hair, because it really, that's the whole thing where it's webbed from, and everybody else is nearly twice. I mean, I have women and men who have told me they spent $5,000, $10,000, $15,000 on hair removal. I mean, we could do your whole body for, I can't even understand that, but that's what it was. So, shaving bumps, terrific, the before and after. I got interested in this hair removal because of people, black men who in the Navy would get kicked out for the shaving bumps because their curly, kinky hair, they couldn't wear a collar. It was my whole spark of the interest, and this really cures them. It's terrific. Fillers tonight, basically you see on my building I have hyaluronic, we have Juvederm up on the building. All my, and Liz will be here tonight for any questions, but all of my fillers are hyaluronic acid or this Radiesse, which is a calcium hydroxyapatite molecule. So fillers were developed because collagen was only lasting 6 to 12 weeks. It was breaking down. You had to test everybody. So these incredibly smart people came up with developing hyaluronic acid and in various thicknesses. So if you want to plump up a woman or a man's lips, you want to use a real thick hyaluronic acid like Restylane or Purolene or the Juvederm Ultra Plus. If you want to do crow's feet around the eyes or you want to get the upper lip, you want to use a thin like Juvederm Ultra. So it varies, okay? And then if you want a longer acting, same thing, you don't have to do any testing, you don't have to do anything. Then we use the Radiesse, the calcium apatite molecule. It's larger. Most everybody who does hyaluronic acid treatment with anything, Juvederm, Radiesse, whatever the thing is, and guys, there's a new product every day. I got a drug coming in, I got the brand new, all hyaluronics are the same. The only difference is the viscosity. They're all pure molecules. Nobody can get any problem from it, and if you do, you get a little bump. I can melt it away with a simple injection, and there's no problems. I had a lady, never happened to me. She actually had pain. I Botoxed her. She had like 11s right in between her eyes and like this, and after I Botoxed her, you could still see them. So I filled it with the hyaluronic acid, and she felt it caused her pain. I gave her the injection, went away, she was totally fine, and I put the rest of it, because she didn't use that much in her nasolabial fold, and she was okay. So there's no contraindications, terrifically safe medicine. I'm gonna show you some before and afters of Dr. Mary will go over the Botox, and I'm going to have Robin come up and I'm going to show you the filler, but here's some before and afters. We're jumping from fillers to Botox. Botox is a paralytic. Mary will go over this with you all. I'm not going to steal her thunder, but it paralyzes the muscle for about 3 months. This is a filler of the Juvederm Ultra Plus. You can see how we picked up the nasolabial fold, and I'm going to actually show you that tonight. A nice before and after of the Juvederm filler. So this is my closing thoughts to you all. Helping you achieve your personal best, having a more relaxed and useful look, and a rested, healthy appearance is really what we're all about. I'll say this before I bring up Robin. Tonight there are some patients in here that we brought in. There are some new faces that patients have brought in, but I will say this. We're here every other Wednesday or Thursday night. And this is an average size. We have standing room only sometimes, but it's about like what you said. I love the fact that you came here with your questions that you're asked. Usually there's many more questions than you were mostly, but I appreciate that.